All right. This is bittersweet. By a strange coincidence, maybe not, we have two board members who have been in service to our community and specifically to our Board of Health for 2 5-year terms. So 10 years in the saddle, so to speak. I'm trying to remember what I was doing 10 years ago. I think that was back with Alexander Fleming and penicillin, wasn't it? So, that long ago.
All of us.
So, I'm not that old. Okay. So, ladies first, Vicki Broerman, and we're gonna make a kind of a big deal out of this and see if we can embarrass you. But the point being, we wanted to say thank you so very much for your dedicated service for 10 years. And that is not a small accomplishment. And I wanted to say personally that I have really appreciated you and your insightful questions in these board meetings, because I really think that helped me. And as your duties also as vice president of the Board of Health, I knew I could rely on you to get to the meat of the matter and if needed, conduct the meetings without any drama. So thank you very much. I think we have some other board member comments for Vicki Broerman.
I know Commissioner Bremer was going to send some videos.
Did we get that video?
Yeah. Okay.
The video? Well, that sounds ominous. Okay, we're gonna skip the video. So there's the camera. We're gonna do an elbow bump here.
Thank you.
For benefit of the board members and a photo op. Here we go. Thank you, Vicki. And could you maybe also tell us about what your new job is, what you're going to be doing?
Dr. Turbish, can
Yes.
I say a few words?
Please, Director Wheelan.
Your future, but I just wanted to thank you, Vicki, because we've worked very close together. I've been with the agency for 20 years, and in 2011 you became a Board of Health member, and you've been completely engaged and supportive of all of our work. I want to point out two things you really championed with the Board of Health and also increasing. So one of them for the Women's, Infant, and Children program, and taking the initiative to help us funding for that program. And that was quite some years ago. I don't know exactly what year ago that was, but the importance of moms and babies and nutrition has been something that you have a lot of passion for, and which has helped our program and our agency advance. So that's one. And we only came up to that with your support, including the Board of Health, and using those fund reserves. And I can't imagine not having that strong team, and that strong team also includes the development of our data analytics office. So you are part of that. So thank you. And then the last thing, which is really exciting, and I think that our county has needed for a while, and sometimes, you have to wait for the right time for things to come together, but your support and engagement of the purchase of the south building and the southern portion of the county. So thank you greatly. I know that you came out there to visit the site with a couple of times, and I've also just appreciated that, you texting me or calling me and asking me if I need, what do I need? and it is focused on, the entire team, not just me as an individual. So I am going to miss you. And I still have your cell phone number. And I think the world of you. I mean, we attended the National Association of Board of Health conference together where we, got to know each other a little bit with Kari and Dr. Turbush. But I just want to say how much I appreciate your volunteer service because there has been a lot happening within the 10 years that you have been serving on this board. So thank you. I appreciate you. And the public health team appreciates you.
Thank you very much.
Thank you, Susan. Other Board of Health member comments? Yes, Sam's got his hand up, please.
Can you hear me?
We do.
Yes, I would like to thank Vicki and Dr. Bux both for all the support that I've received in the south end of the county here in Fountain. And I just really appreciate the help that they've given me, and thank you very much.
Thank you, Councilmember Gee. Let's see, we have Commissioner Gonzalez has his hand up, please.
Oh, thank you. I too want to thank Vicki and Dr. Bux for all the great work they've done for us. I mean, so many things that they've provided input on and mentorship to me on public health over my first 4 years. We clearly have been a better board for their involvement these past 2 terms for them, but greatly appreciated from me and the county commissioners. Thank you so much.
Thank you. All right. Well, and we have another farewell gift for Dr. Robert Bux, if you wouldn't mind. Although there's we'll stare into the big eye. And thank you, sir. Thank you. And photo up. There we go. Okay. And just a few personal comments. I really enjoyed getting to know you, and not all the folks here know what a colorful background you have, and plus all of the service that you've provided to our community this last 10 years. And I hope that you might also check in from time to time with us, and we have his phone number too, right? Okay.
We have his cell phone number also.
Okay, very good. And do you have any comments for us about what you think you might be doing next? I think I heard about a project that you're doing.
I've been doing medical legal consulting since probably 1985, and I'm still doing some. And the last 2 or 3 years, it's kind of gone to focus on innocence projects, and I've got a few cases with that. And we also had one of a man that was on death row in Louisiana that is now free, based on some faulty things that occurred in his trial and with the quote experts they had that testified. So that's one thing, and then I'm going to spend some time with my grandkids, and my wife and I are going to travel here once we all can travel. And I'd like to make one comment. I don't know about Vicki, but the most important thing that I think that I've done on this board, and I think Vicki too, because I think you have to realize we're on Public Health Director number 4. Okay, and Vicki and I were on the search and interview committee for 3 of them, the last 3. And that to me was one of the most important things and the most satisfying thing is to watch each of those directors bloom and move us down the street. And now we're in the middle of an expressway. I mean, that's the way this department is working. We're not on a country road anymore. So, thank you.
Well said. Well said.
Can I say?
Yes, please.
Yeah, try not to get emotional. It's been a privilege and an honor to serve the citizens of this county and to work with such incredible staff. And I was thinking about this last night, and Bob and I our first meeting together was in that old moldy conference room.
Asbestos still. Let's make sure we put all the adjectives in there.
Yeah, it was rough. So to see in 10 years what the El Paso County Public Health Department, Bob touched on it, has become is incredible. We moved over here, we had fire, we had flood, we had fire, we had flood. We weren't getting we still aren't, but we're better getting the population money that we should to serve our citizens. And somehow your staff figured out a way to make it all work. And that's incredible. Now we have I forgot about the pandemic. I'm going to forget about the pandemic. But we also had a hepatitis pandemic, and not pandemic, but hepatitis outbreak. And so many things have occurred here. And it's been a privilege, and it's been an honor. And I don't know what I'm going to do every third Wednesday of the month anymore. Obviously, nursing is my passion. That's what I do. So I've been given the opportunity to develop and grow a nurse trauma navigator for the state of Colorado. And I'm looking forward and jumped into that and pretty excited. So thank you. Thank you for trusting me, and thank you to the commissioners who are no longer here, but who appointed me to represent the citizens. I am humbled by that. So thank you.
Well said. Thank you.
And I would echo for me also that it has been an honor to have this job, and to been given the trust that has gone along with it. That's something I'll remember always also.
Well said. Very well done.
Dr. Trevors, I just
Yes,
want to say a
please.
few things about Dr. Bux as well, if that's okay. I wanted to just mention too, I mean, you've supported us in building our infrastructure with the 10 full-time employees, and that has been very much appreciated, and also has been a champion for the purchase of the South Building. And I think something that is very notable with your leadership within the past few years, back in 2013 and 2014, is your office's leadership with the Child Fatality Review Team and the development with us spearheading the Teen Suicide Prevention Group, which is a very active group still. There still is a need, and that coalition and those partnerships with multi-sectors have, they are still diligently working, and still a lot of work to do, but that was with your office and your leadership, and I appreciate that. And you guys bring back memories as well, because since 2011, when you both started, there has been numerous changes and a lot of progress. But I wanted to echo what you both are saying too, is that the incredible team that public health has, we may not see them at this meeting all the time, but they are dedicated servants, and they are so much expertise. And they are just an incredible team. So thank you for acknowledging that, because they care deeply about this community. And with your leadership and support on the board, it helps our entire team do the work that we do. So thank you.
Dr. Turbish?
Yes,
Councilmember Avila chatted in a couple comments. Do you mind if I read them, since you can't see them? She said, this is from Councilmember Avila. She said, Vicki, I really appreciated your good work and your thoughtful questions. I learned a lot, and I was grateful that I was able to sit next to you before we all went virtual. I wish you the very best. She also said, you're both amazing, and El Paso County Board of Health is so much better for it. And Kari typed in, ditto to everything everyone has said about both Vicki and Dr. Bux. I've learned so much from both of them with their different styles, approaches, and perspectives. Our board is stronger because of them, and they will certainly be missed.
be a huge void as you leave, and you will both certainly be missed. And again, thanks from all of us for your service these past 10 years.